Are you frustrated by your chronic lower back pain? I'm Dr. Mare Moolman from South Africa, chiropractor. I will be talking on internal disc disruption, also known as discogenic pain syndrome. If one had to Google common causes of lower back pain, a list like this may be found. Soft tissue strain injury, loss of core muscles, loss of flexibility, obesity, herniated disc, scoliosis, osteoporosis, spondylolisthesis, osteoarthritis, and a few more that I haven't mentioned. But typically the list will not include internal disc disruption or discogenic pain syndrome. The following material can be read in greater detail if you go to chirogeek.com and read Dr. Gillard's page on discogenic pain syndrome. In 1986, Dr. H.V. Kroc told the International Spine Society that internal disc disruption could cause lower back pain and even lower limb pain without the presence of spinal nerve root compression. He came up with the term internal disc disruption. In 1995, a dream team of Volvo award-winning authors tested Kroc's theory. They calculated that 30 to 50% of people who suffer with lower back pain have internal disc disruption. Famous multi-time Volvo award-winning author, Professor Nikolai Bogduk, MD, believes that internal disc disruption is the most common cause of chronic lower back pain and may often be overlooked by the treating physician. Please note I'm a chiropractor, not a neuroanatomist, so some latitude please. Between the vertebrae we have a shock absorber, a spacer we call the disc. The disc on the outside has the annulus fibrosus, which are between 10 and 20 rings or lamellae that holds the nucleus pulposus in the middle. Nucleus pulposus is a gel-like substance made mainly from water. Nutrition for the disc is by a pump mechanism or osmosis. As the disc compresses, waste products and water are pushed out, and as it expands, water and nutrients are reabsorbed. The nervous system of the disc, we have our brain, spinal cord coming down the spinal cord, and off the spinal cord are the spinal nerves exiting, and in the lower back, the spinal nerves go down into the legs. Interestingly, there's a little nerve that backtracks off the spinal nerve, called the sinovertebral nerve. Backtracks to the disc, and it has nociceptors or little nerve endings that reach up into the outer third of the disc. This nerve was identified in 1850. So what we have is a closed hydraulic system with its own nutrient and nerve supply. So how does the system fail? How does injury occur to the disc? You could have a car accident where there's severe trauma to the disc, compression with maybe a bit of twisting. You could have from very heavy lifting, boat, caravan. You could have torsional twisting work, like somebody working with a spade or an axe all day. And you could have, just from bad posture, i.e. chronic leaning forward all day, squashing the front of the disc. And you could have, just from bad genetics, a dicey disc. Typically, the fissure starts from the center of the disc, from the nucleus pulposus. Injury occurs and a little fissure or a tear starts to move backwards towards the sinovertebral nerve. This fissure moves further and further, and as it moves further and further, it starts breaking the lamellae one after the other as the fissure moves further and further. Something else though has happened. Due to the trauma to the nucleus pulposus, there's been cell death, with a splitting one ring after the other of the lamellae. More cell death has occurred. Degeneration has started. A toxic soup is now starting to form from this death of these cells. So as we put more and more mechanical strain on this disc, the fissure moves further and further. Interestingly, there will be two forms of pain. Mechanical, as we squeeze, cough, sneeze, we compress the disc and this fissure moves further and starts mechanically pushing against the sinovertebral nerve, causing pain. The other form of pain is chemical. The fissure has now become a pathway for the toxic soup to reach the sinovertebral nerve. As we cough, sneeze, twist, lift, this toxic soup can now reach the sinovertebral nerve and irritate and inflame the nerve. We have now what I understand to be internal disc disruption with pain. Or said another way, the body has given us the first warning with pain. Internal disc disruption is a common, debilitating and painful condition. And intriguingly, most healthcare providers are unaware of the condition. Typically, the patient has been to a physiotherapist, no real help. Been to a chiropractor, no real help. Been to a GP, had an X-ray. X-rays do not show internal disc disruption. Been to a specialist, had an MRI. MRIs are inadequate at diagnosing internal disc disruption. The only relief the patient has is from strong medication, but this is only temporary. The distraught patient still does not have the correct diagnosis and therefore not the correct management plan. I hope for those of you in healthcare who read further about this condition, and for those of you who possibly suffer from internal disc disruption, this talk and future talks may help you to understand your condition better. If there is interest in this subject area, I will do further talks on diagnosis, followed by evaluation, management, and possible healing of internal disc disruption. Thank you for listening to my talk.